I'm very delighted to be talking with you today, and for the benefit of my Health Power audience, in fact, my audience is Health Power for minorities primarily. I want them to know that you, Dr. Ho, are an internationally recognized retina surgeon and director of retina research at Willis Eye Hospital of Ophthalmology in Philadelphia and the Kimmel School of Medicine at Thomas Jefferson University. So it's certainly my pleasure to have an opportunity to talk with you today. Today is a good time. November is a good time for us to be talking because it's National Diabetes Month, and for us to be discussing diabetes as a leading cause of vision loss or blindness. So let me welcome you again, and thank you for spending this time with us. The two terms I want to get you to explain in layman's language for people who are not physicians. One of them is the retina. What's the most basic, simple explanation you could give to a lay person or a lay audience of what the retina is?
Thank you, and that's a really good question. The retina is inside and in the back of the eye, and if the eye was like a camera has a lens up front and film inside and in the back. The retina is the film in the camera. So it's inside the eye, it's where your vision cells are, and it's where one of the areas, and the most common area, where patients with diabetes have problems that lead to vision loss or even blindness.
All right, and is there, what happens to that retina that causes the blindness?
The most common reason for vision loss with diabetes is something called diabetic macular edema. And that's a medical term that refers to swelling in the focus point of the eye. The macula is the focus point of the retina. And that's the way people lose vision commonly. What we need to get the message out about is that patients with diabetic macular edema can have treatments for that, and treatments work better if the problems are detected earlier. And therefore, we're encouraging all patients with diabetes to get an annual dilated eye examination to detect problems.
And I understand, Dr. Ho, there was a recent survey concerning the extent to which people with diabetes receive an annual eye examination. Was that a CDC survey?
It wasn't a CDC survey, but it was a survey of over 1,000 patients with diabetes conducted in collaboration with Regeneron. And it showed that despite this very common cause of vision loss, and in fact the number one cause of blindness among working-aged adults, patients are not aware of their risk of diabetic vision loss when they have diabetes. And furthermore, up to a third or more of the patients are still not getting the recommended annual dilated eye exam to protect their eyes against potential vision loss from diabetes.
And how difficult is it to obtain that annual eye examination?
It's not.
I guess I'm asking about things like health insurance coverage.
Health insurance coverage, most health plans do cover an annual dilated eye examination for patients with diabetes. So that's not a typical barrier, although it can be. I think the main barrier is that patients aren't aware of their risk when they have diabetes, the risk of vision loss. And number two, patients that are not having symptoms, they're not having any blurring of vision, don't feel the need for an eye exam. We want to emphasize that if you have diabetes, all 29 million Americans with diabetes, and that number's growing, should have that annual dilated eye exam regardless of whether or not there's vision symptoms or blurring.
Okay, and so you mentioned blurring a couple of times. Is that the main symptom that one might have if one has diabetes and is developing retinal disease?
Yes, you can have slow progression of blurring of vision, or you can have sudden vision loss, let's say from a bleed inside the eye. So the cadence of vision loss can be variable depending on what the problem is inside the eye. The point being that we need to see those problems sooner. We won't see those problems sooner unless you get that dilated eye examination.
Okay, and is there anything? Is that the most important thing a person, an adult with diabetes, can do to minimize the damage to the retina?
Yes, getting the annual dilated eye examination is among the most important things that a patient with diabetes can do. The other general health guidelines that you would hear from your primary care doctor also apply to the eye. That is, keeping your blood sugar in good control, choosing the right foods to eat, maintaining ideal weight or close or striving for that, getting regular physical activity like walking 30 minutes daily most days of the week, and certainly avoiding smoking. Smoking plus diabetes is really a powder keg for problems inside the eye.
That's interesting. Is that primarily with diabetes, or is smoking not good for the eye overall?
Smoking is not good for the eye overall and is particularly bad if you have diabetes.
Okay. One other question I have, because there's such a high correlation between diabetes and obesity, I'm wondering if we should also be saying that people who adults who are obese should also be getting an annual eye examination.
Well, that's an interesting point. I think just because you're obese, though, does not mean that you have diabetes, although you're at higher risk for it. So I wouldn't step to that conclusion that if you're heavy that you should get an annual eye exam. But certainly, if you have diabetes, and there are so many of you out there, or if you know of someone with diabetes, please encourage them to get that annual dilated eye examination so we can get to their problems sooner. We need to educate patients. There's a new website, diabetessightrisk.com.
I'm sorry, give me the website.
The website is diabetessight, S-I-G-H-T, risk.com, where patients can get...
Slow down, because I want to be sure.
Sure.
Diabetes site.
risk.com. You got it.
www.diabetessightrisk.com.
Perfect.
And who's running that site?
Well, it's a site that has patient-friendly information on diabetes in the eye. It describes what it's like to have a diabetic eye examination or a dilated eye examination. It doesn't hurt. Don't be afraid of that exam. And it's a resource for patients with problems because it can direct you to a local retina specialist who can give you state-of-the-art care for diabetic eye problems in the back of the eye.
I see. And I gather you're involved with that website?
I went on that website and actually think it's an excellent website because it's very plain English and patient-friendly. And I strongly suggest people visit diabetessightrisk.com.
Thank you. Well, it has certainly been good talking with you today. And the one other thing, since Health Power, which is my website, is actually Health Power for minorities and focuses especially on minority health care, is there anything in particular that you think we ought to also emphasize concerning diabetes and minorities in terms of risk?
Diabetes is really race agnostic. It affects all different races, and therefore these recommendations of getting that eye exam and trying to stay healthy, I think apply to everyone.
Right. Okay. Well, I certainly appreciate your input, and we will certainly see that this information gets out.
Thank you so much for your time.